Hi guys! Today we're going to talk about acid reflux, how to avoid it, complications it can lead to, the causes, how to diagnose it, how to treat it. Lately, due to the COVID-19 pandemic, I've been doing a lot of telemedicine visits. Patients complaining, for example, I feel a lump in my throat, or I'm having a flare-up of acid reflux, I need a refill of my medication that I stopped taking 6 months ago because the symptoms are coming back. Or things of, I'm having a lot of heartburn lately, what can I do about it? So what might be the reason? Stress is one of the reasons. And now that we are living in the COVID-19 pandemic, the level of stress is going up. So what is acid reflux? Acid reflux is when the content in the stomach moves back into the esophagus or mouth. So the esophagus is a long structure that looks like a tube. It connects to the stomach, and what it does, it delivers the food. So when we eat, the food goes from the mouth to the esophagus to the stomach. And it has a muscle at the end. It's called lower esophageal sphincter. The lower esophageal sphincter, when we eat and the food goes through that tube, relaxes. When it relaxes, the food goes to the stomach to mix with acid to help with digestion. And then it contracts. But if it doesn't contract when it's supposed to contract, the acid or that fluid in the stomach can reflux back to the esophagus, causing acid reflux. Acid reflux is normal, and all of us from time to time experience it. But if it becomes more frequent, then it can lead to gastroesophageal reflux disease, Gerd. So what are the signs and symptoms that your body might be giving you to tell you, hey, you might be suffering from Gerd? Difficulties when swallowing, heartburn, chest pain, and in some cases, patients would complain of sense of a lump, or they can come and say, I'm having that cough, that dry cough, and I cannot get rid of it. I saw the doctor, put me in antibiotics, we did an x-ray, my lungs look okay, my doctor told me it has nothing to do with my lungs, what could it be? In a lot of cases, it can be related to acid reflux. How about some medications that some patients use on a daily basis to treat certain chronic conditions? Can they lead to Gerd or acid reflux? And the answer is yes. Some of the drugs that can lead to acid reflux or gastroesophageal reflux disease include calcium channel blockers such as amlodipine, nifedipine, and in some cases are used to treat high blood pressure. Also, some of the cardiac drugs such as beta agonists, dopamine, nitrates, along with anticholinergic drugs, progesterone, morphine, and the list goes on. So please check with your pharmacist or doctor if you think that one of your drugs is causing you acid reflux. Some of the drugs that patients take on a daily basis to treat chronic conditions can actually lead to the decrease in the esophageal lower sphincter pressure, leading to acid reflux or gastroesophageal reflux disease. But is gastroesophageal reflux disease or GERD only caused from a decrease in the pressure of the lower esophageal sphincter? No. In fact, GERD is multifactorial. The decrease in the lower esophageal sphincter, which can lead to acid reflux or GERD, is actually only seen in 25% of the cases. Some of the other reasons that can lead to GERD include patients with hiatal hernia, obesity, and that's because the pressure in the abdomen in some cases can lead to acid reflux. Pregnant females experience acid reflux, and once they deliver their babies, the acid reflux go away, assuming it wasn't a chronic condition prior to pregnancy. Eating certain food can lead to GERD. This includes chocolate, fatty food, and even peppermint, or food that contains anything citrusy. Even eating too much tomatoes or tomato sauce can do it too. Consuming too much caffeine and alcohol can lead to GERD, in addition to smoking cigarettes. What can we do about GERD, and how can we diagnose it? First thing we can do, if the symptoms are not alarming, we can place the patient on acid reflux medications for a period of 14 days and see if the symptoms go away. Great, then we have our diagnosis. If the symptoms do not go away, then we can send the patient to a specialist for further evaluation and management, or we can explore other reasons why that patient might be suffering from those symptoms. For example, if a patient comes in complaining of persistent cough is not going away, in some cases we place the patient on acid reflux medication and boom, cough disappears, which means the cough was secondary most likely to GERD. Know that some symptoms related to GERD can actually be seen in other cases such as esophagitis and H. pylori. Some of these symptoms might include chest pain, difficulty swallowing. That's why it's very important to identify the cause, because the treatment probably would change if the cause is not just related to frequent acid reflux or GERD. If it's, for example, due to esophagitis, which is caused from a possible infection or even from irritation to the esophagus, such as vomiting or radiation, then the treatment is going to be different. If the cause is related to H. pylori, an infection in the stomach that can lead to ulcers and symptoms similar to the ones that we see in acid reflux, such as the chest pain, then the treatment would be get rid of the infection, the H. pylori, with antibiotics along with some acid reflux medication. And that's why finding the cause of the symptoms is very important in order to reach the cure. Who should be screened using an endoscopy? Patients experiencing alarming symptoms such as difficulty swallowing, unexplained weight loss, anemia for an unknown reason, or high-risk patients who develop symptoms at night related to acid reflux, or patients who have persistent symptoms despite using acid reflux medication. But what else can we do to ease the symptoms of acid reflux or GERD besides taking medications, or aside from taking medications in some cases? Lifestyle modification. This includes losing weight for patients who are obese or overweight. Also, you can raise the head of your bed about 6 inches to allow gravity to stop acid from refluxing. This would help only if you are experiencing nighttime symptoms. Avoiding food that can trigger your symptoms, such as excessive caffeine, excessive alcohol intake, fatty foods. Besides, smoking. Quit smoking if you are a smoker suffering from GERD. Quit smoking if you're a smoker, period, due to other complications that smoking can lead to. And that's another topic. Avoid eating late meals. Try to have your last meals at least 3 hours before going to bed. And if you try lifestyle modifications but your symptoms are not going away or they're not resolving completely, it's okay. We can use some acid reflux medications that can help. And there are so many drugs to choose from. Some of the anti-acid drugs that we can use for the treatment of GERD include drugs from the family of the histamine receptor antagonists, such as Pepcid, which can be used to treat mild symptoms and is also found over the counter. In the case of more frequent symptoms, we use different classes of medication, which belong to the family of proton pump inhibitors, PPI. PPI drugs include Prilosec, Protonix, and Nexium. Now I want you to listen carefully and be aware. I'm going to say something very important. In April 2020, the FDA has removed from the market a drug used for the treatment of GERD or acid reflux belonging to the antihistamine family called ranitidine or Zantac. This happened after they found that it contains NDMA, a substance that can actually lead to cancer. So if you are taking this drug, please get rid of it and stop taking it immediately. Speak with your healthcare provider for an alternative. Also remember, if you're suffering from symptoms related to GERD or acid reflux and you're given medication, but despite taking the medications, your symptoms are not going away, please see your doctor. If the symptoms might be related to another cause, such as esophagitis, acid reflux, and in some cases, cancer. If you enjoyed watching this video, please subscribe to my channel as Dr. Dana on YouTube, like and share. And if there's a topic that you want me to talk about, write it in the comment below.